जी। श्वेता जी बताएं। तो हम लोग अभी रैशनल इमोशन बिहेवियर थेरेपी की बात करने जा रहे हैं। बताएं।
Yes, REBT.
हम्म।
Okay. So REBT, it's a type of behavioral therapy, which is a direct evidence-informed cognitive behavioral approach, counseling approach that teaches people to identify and change their irrational beliefs that they have encountered in their life that drive their emotional distress, conflict, and self-defeating behavior. And at VHC, we deliver two offerings related to REBT that is tailored for the international community.
हम्म।
First is the professional training course that is for psychologists, counselors, and healers, and practical REBT sessions for the general public focused on the relationship coaching and emotional wellness. So REBT is a
जी बताएं।
Okay. So REBT is a cognitive approach, cognitive as in our thoughts and our belief system. It is analyzed through some approaches, and it is also a evidence-based approach, as in we are collecting evidence that why your thoughts and beliefs are relevant to each other, and what is the evidence for and against them, that why they are true, why they are not. We generally focus on the evidence based approach, a counseling approach that teaches people to identify their beliefs, their thoughts, and then change those irrational, as in those negative uh, patterns, those negative beliefs that are not helping them and that drive somewhere emotional distress, emotional discomfort in their life, conflicts, and self defeating behavior. Self defeating behavior, as in those are not helping them, those are maladaptive to their functioning and somewhere hindering their overall functioning and performance. And at VHC, we deliver two different offerings for the REBT program. That is a professional, first is a professional training course that is available for our psychologists, counselors, and healers. And secondly, practical REBT sessions for the general public focused on relationship coaching and emotional wellness. And if we talk about how REBT is different from CBT, that is a cognitive behavioral approach. In REBT, we more focus on the emotions part, where the person is more driven by the emotions. They are not able to manage and regulate their emotions. REBT is a best substitute for that. And what to expect during this? This is an intensive practice focused REBT training and
यहाँ पे एक सेकंड हम रोकेंगे। ये यहीं
hmm,
पे जैसे आपने बोला दो तरह के हैं, एक प्रोफेशनल ट्रेनिंग कोर्स है। तो इसका
hmm,
मतलब ये हुआ कि कोई साइकोलॉजिस्ट है, वो चाहता है कि वो आरईबीटी में अपनी एक्सपर्टीज ले ले और वो आरईबीटी की भी का भी थेरेपिस्ट बन जाए।
hmm,
एक तो
hmm,
हम
hmm.
उनको भी ट्रेनिंग देते हैं, वो उस तरह का मेरा कोर्स है अलग जो कि साइकोलॉजिस्ट के लिए है। और दूसरा
Yes.
जनरल पब्लिक जो हील होने के
Done.
लिए आ रहा है आपके पास,
Hmm,
उसके
hmm,
लिए
hmm.
है। ठीक है, तो दोनों के पैकेज अलग अलग हैं क्या?
Yes, that is a training program, and one is our sessions, counseling sessions.
तो ट्रेनिंग प्रोग्राम में क्या क्या होता है चीजें?
So in training program, we have a particular format, we have a particular course structure for that, and we are training the psychologists, counselors, and healer based on the modules. What kind of techniques they should use in REBT? What are the approaches they can use in REBT during the sessions? And what are the different type of conditions that can be addressed using REBT technique? So that's a complete professional training course that we offer to different psychologists, counselors, or any psychology passionate.
कोर्स के लेंथ क्या ड्यूरेशन क्या है? इस कोर्स का कितना लंबा होता है, कितने सेशन होते हैं?
REBT training course,
यस, ट्रेनिंग कोर्स।
sir.
ठीक है। अच्छा, सेशंस
Yes.
में आप हम लोग पहले इस इनके सेशंस में, अच्छा बताइए, कोर्स में हम समझ गए। अभी आपको उसकी
Hmm.
जानकारी नहीं है कि एक कोर्स में कितने सेशंस होते हैं, एक साइकोलॉजिस्ट बनने के लिए उसको कितना ड्यूरेशन का कोर्स करना पड़ेगा। बट आपके पास
Hmm.
बने हुए मॉड्यूल्स हैं, उन
बने
मॉड्यूल्स
हुए
के लिए
मॉडल।
आप ट्रेनिंग देते हो। तो मॉड्यूल्स में क्या है, मतलब कुछ रिकॉर्डिंग्स हैं जिसको उन्हें देखना होता होगा, कुछ रिटर्न में आपके पास कंटेंट होगा, मटेरियल जो आप शेयर करते होगे, कुछ असाइनमेंट्स होते होंगे जो आप उनको देते होगे जो उन्हें करके लाना होता होगा, ऐसा ही है?
Yes, sir. In REBT, what happens? There are not recorded sessions, but we have different modules. That is a theoretical part of REBT, and also the worksheets are also included in that. That how we have to go about what are the techniques for REBT, the theoretical part about REBT, and how these techniques are applied in the practical setting. In the we have role play sessions for that in the training course, and that how you have to apply these technique in your sessions, and also we provide them worksheets related to REBT.
ठीक है। अच्छा, सेशंस में क्या क्या चीजें होती हैं, ये कितना, इसकी कितने सेशंस होते हैं या हो सकते हैं, इसमें ड्यूरेशन क्या होती है?
Yeah. So just like the counseling sessions, REBT, we consider REBT if the person is if more depending on the emotions part, and the person is not able to regulate his or her emotions. So we use REBT, and typically we have sessions just like CBT. We have sessions, 5 to 7 sessions for REBT, starting from there, and we also provide sessions according to the need of the client.
अच्छा, ठीक ठीक। आगे बढ़िए, कंटिन्यू करिए।
Okay. So, what to expect in our program? It is an intensive practice forced REBT training and certification course delivered by experienced psychologists at our center, and who provides curriculum and syllabus according to that. That includes your REBT theory, the philosophy, and the case conceptualization, that how you have to deal with those cases where you have to regulate the emotions of the people around you. Then functional assessment techniques for disputing those irrational beliefs, irrational as in unhelping beliefs, those are somewhere disrupting your functioning, your cognitive mindset. Behavioral experiments, how, as in how you are practicing those techniques, how you are practicing those beliefs in the reality, and emotional regulation strategies, ethical considerations, and also theoretical part about how these practices are culturally adaptive. What are the cultural adaptive practices that we can adhere to REBT in our culture? And also, we have, apart to the options, we have a short professional certificate foundational course, and we have advanced clinical practicum, and the trainer pathway for those who want to teach REBT, as if they want to learn the REBT to get themselves trained and further teach REBT to further population. And REBT, it's a evidence-based toolkit that provides clear, time-efficient interventions that integrate your cognitive, your emotive, and behavioral change strategies. We are combining all the three approaches, be it your mind, be it your emotions, and be it what kind of behavior you are projecting. And this is ideal for psychologists and healers who want measurable outcomes in their sessions. And also, REBT is helpful, useful for relationship problems like anxiety, anger, grief, low self esteem, because again, here our emotional patterns are engaged more, and many chronic patterns that show up in multicultural context, because REBT is more focused on emotions and your philosophical approach rather than the cognitive approach. It more focuses on the emotions part rather than the cognitive or a thoughts part, and it emphasizes on experiential learning and also supervises practice, so you leave confident using REBT in individual, group, and group formats. So we provide for the confidence part, we provide role plays that you are in the training sessions, you have to role play as a therapist and a client, that how you are practicing those techniques, how you are practicing REBT sessions to your client, and what are the techniques that you are applying on them, and that leaves you with the confidence that you are able to take their sessions. during the role play mock sessions, and we are also providing constructive feedback after that role play. A constructive feedback will be provided to you so that you are more aware about your understanding, about your mistakes, about your learnings overall, by the trainers, by the therapist, and by the doctors present over here. And also, we address the cultural and international readiness, as in training module. They includes modules on cultural adaptation, that how you have to adapt to the culture, different cultures, how REBT can be adapted to different cultures, how we have to go about them, depending on what kind of culture, what kind of background you're coming from, or what kind of culture you are adhering to. And working with immigrant populations who are not from this culture, and language sensitive assessments, and also adjustment for diverse relationship norms. So REBT, it's a helpful approach there.
हम्म। ठीक है। जी बताएं ये
Okay, should I
किस।
start?
हाँ हाँ बताइए, ये किसके लिए है? जैसे वो वाला समझ में आया कि किन के लिए है, आपने इससे पहले पेलर वाला
Hmm.
जो केस बताया था, अभी ये और वो अलग कैसे है? ये किस चीज के लिए है?
Hmm. So REBT is for any licensed psychologist, any counselor, who social worker, psychotherapist, healers who want to expand their knowledge, who want to expand their evidence-based repertoire, who are not aware of the different approaches, who want to gain more clear understanding of the REBT approach, the more emotional and philosophical approach. It is the best suited approach for them. And the coaches, and be it any energy workers who want a structured cognitive emotive framework to pair with any other somatic, any other cognitive, or any other somatic or spiritual modalities. And also that clinic leads and NGO mental health coordinators who need scalable skills, who for staff, for training and supervision in international settings, so they can help other individuals, they can help the individuals who are living in an NGO setting or in any other settings, that can help them assess their emotions in a more better way. And so yes.
जी बताएं।
And also for the people who are, this is also for the people who are not aware, who are not clear about their emotions, and who are somewhere lacking a comfort in their emotions, that where am I going with, and where am I, what am I dealing in my emotional life. So REBT is a very helpful approach to go with that. RBT is a very helpful approach where people can understand and regulate their emotions in a more better way, and replacing their irrational, unhelpful beliefs into more positive and more philosophical ones, that can help them gain a positive understanding about their emotions and themselves at the same time.
हम्म। ठीक है।
इसमें भी थोड़ा बहुत सेशन का आ जाएगा। ठीक है, मैं ये थोड़ा और एक्सप्लेन करती हूँ।
हम्म।
ओके, शुड आई स्टार्ट?
यस प्लीज।
Okay, so when a question comes, why choose this service as VHC? So we have a competency in REBT case conceptualization, and what are the kind of treatment planning, what is the treatment approach of ours, and we have a toolkit of worksheets, session templates, homework strategies that you can use immediately. And we have supervised case hours and peer feedback to accelerate clinical confidence. As I told, that there will be a constructive feedback will be provided to you after your mock sessions, after your role play. And also REBT sessions for the general population, it provides short-term sessions for individuals and couples tailored to their emotional or relationship issues, where their emotional wellness needs are not addressed through the partners. And also we have sessions, again formats available. We have single session consultations, 6 to 12 sessions, short term packages, and ongoing maintenance sessions for your understanding, for your maintenance further in your life. And we have techniques like identifying and disputing irrational beliefs, practical exercises to change your emotional reactions, to how to differentiate your response from the reactions, and how you can generalize those techniques in your daily life. Communication helps in skill building for couples among themselves, how they can communicate with each other, how they have to address their emotional and personal needs to each other, doing behavioral experiments, and how also these this in this we help in relapse prevention plans, that what if the situations comes again and it tries to disrupt your patterns again. So you are ready with your prevention plans, your relapse prevention strategies, and that will make you yourself, the client will be their own therapist at a time after that, if they are aware that how they have to deal with their relapse prevention strategies. And also we deliver on offline and as well as online sessions with homework provided. And individuals who are seeking better emotional regulation, want to reduce their anxiety or anger, their relief from any persistent negative thinking that is coming again and again, the persistent loop they are continuously that is holding them back in any particular way, and that is somewhere hindering their occupational, their social, their personal life. And also the couples who are wanting a clear communication among them, conflict management tools, and a shared language for their emotional needs and how they could communicate with each other. And for the in case of international clients, we have for the migrants, for the multilingual families who need flexible timing, we are available for that. And culturally sensitive we use culturally sensitive approaches according to the culture, according to the background. We move with our practical tools, and that can be used across various contexts. And somewhere it has shown faster reduction in stress, in distress, and relational conflict through targeted homework driven interventions. Homework is necessary because then you know how to use those techniques, how to journalize those techniques in your daily life, and that will help you gain a better and clear understanding about your own thought patterns, about your own belief, what kind of belief you are encircling around. So homework will give you a better and clear understanding of that. And also it is a measurable process through session goals, and so we use short assessments throughout. And yes, we have flexibly online access for busy or international schedules, or any person round the corner or around the world. Okay, again. Okay.
जी.
So, why I choose this service as VHC? So, we at VHC, we provide fast and skill-based change through REBT, which is a solution-oriented approach, that we are focusing on the solution rather than focusing on the problem. We are focusing on the solution that helps equips the client how they think and how they feel quickly, because it's about emotions they are feeling, which is especially valuable for people who are living alone, who are not who are juggling around high demand lifestyles, who are not around their family, and they're overwhelmed by the emotions they are feeling right now. So that is the best suited approach for them who are emotionally overwhelmed through their daily lifestyle. And also REBT is focused, relationship focused, which addresses common destructive patterns, be it demandingness, be it the blame, or catastrophizing, which is people are making their concerns to a lot एज इन वो अपनी प्रॉब्लम्स को कहीं ना कहीं बढ़ा चढ़ाकर टू अ वे सोचते हैं दैट this is going to happen in our life. If we do not do this, then bad is going to happen. They tend to catastrophize their thing, exaggerate their problems to a certain level, and that in turn escalate, that increases the conflicts, be it in families, be it in partnership, because of the assumptions they are making in a relationship, or be it families. And also, REBT addresses emotional wellness that reduces anxiety, anger, or any other depressive thinking. Much better. By replacing your rigid must and should, as in we are somewhere, we are bounded with those rigid must and shoulds, that we should do like that and we should behave like that, we must do that. So REBT somewhere addresses those irrational and rigid beliefs, that how you should be in this cultural and in this cultural setting. So it also help activating beliefs that promote healthy behavior and connection, be it in your family, be it in a relationship. And it is culturally attuned approach. And our psychologists are experienced working with the cross-cultural relationship dynamics, be it long distance relationship, be it long distance friendships, and the stresses of shifting one place to another, and how these multilingual households are carrying within them. So REBT is a approach that will help address your emotions in a more productive, in a more natural and effective way.